A very good evening to you all. Welcome to the English News Bulletin here on Rwanda Television. We'll begin our edition with the headlines. The Rwandan Parliament has started monitoring more than 100 projects tackling on socio-economic development of citizens to prevent their delay, which would hinder citizens' prioritization. Healthcare professionals warn that antimicrobial resistance to conventional medicines is a growing crisis that demands a collaborative multi-sector response as it poses serious threat to public health. On the international scene, the hunt for Joseph Kony has continued, and the USA is offering a reward for his capture. My name is Olive Nathan. It's always a pleasure to have you with us as we kick off this edition. The Rwandan Parliament has started monitoring more than 100 projects tackling on socio-economic development of citizens to prevent their delay, which would hinder citizens' prioritization. Prince Manzi kicks us off tonight.
Various committees are conducting this monitoring in the Rwandan Parliament. Among the projects inspected at the beginning, there's a grass farming project for the vulnerable who have been given cows because the purchase is expensive for the districts, as well as the project of relocating the peoples living in Mazane and Sharita in Bugesera district. I want to be relocated because my house is in a high-risk zone. It was considered thrice, but I haven't been relocated yet. The house I live in, it is always destroyed by the heavy rains, and my wish is to be relocated and leave this region. Another project that has been delayed due to lack of budget, also considered, is the construction of 215 kilometers of roads in the city of Kigali. Honorable Odette Wamaria, the chairperson of the Committee on State Budget and Patrimony, elaborates on what they have analyzed in the projects inspected. Some have started and at a good rate, and some are having challenges. We haven't collected all, but there are various challenges. And the good thing is that there's a collaboration of all levels in having positive solutions. Overseeing and monitoring executive actions is one of the mandates of the Rwandan Parliament. Currently, projects will be monitored at their pilot phases. This monitoring will conclude with the committees analyzed 113 projects in the 2024-2025 financial year.
Thank you, Prince, for the details. Now to health matters. Healthcare professionals warn that antimicrobial resistance to conventional medicines is a growing crisis that demands a collaborative multi-sectoral response as it poses a serious threat to public health and claims countless lives. We have details on this story. Aline Uineza, 41 years old, recalls that in 2023, she faced severe infections caused by drug-resistant bacteria. The situation became so critical that she required emergency hospitalization for treatment. Infections of the urinary tract are not usually considered serious. You can get one, take medication, and continue with your routine. However, when I had it, it gradually became severe. I went to the hospital and they prescribed stronger medication, but it made no difference. My condition worsened to the point where I became severely ill and was admitted to the intensive care unit. My heart was beating rapidly and the infection progressed from my kidneys to my liver, causing it to swell. Due to the reanimation procedures, I was given multiple injections, which led to additional complications. I developed lung problems. Excess fluids accumulated in my abdomen, and I was gravely ill. I was hospitalized at King Faisal Hospital, but thankfully, I eventually recovered. Health experts emphasize that addressing antimicrobial resistance requires immediate advocacy, education, and action rather than delaying until it worsens. Dr. Isabel Mukagatare, head of Department of Biomedical Services at the Rwanda Biomedical Center, offers guidance on how individuals can contribute to combating this growing threat. First of all, it is important to enhance hygiene. For example, if you do not maintain proper hygiene, such as washing your hands, you may pick up microbes and infect someone else. Secondly, we usually advise residents to follow their doctor's instructions carefully. Often when people go to the hospital, the doctor prescribes medication tailored to their specific illness. However, some fail to use it correctly and may instead decide to take medication recommended by someone else who had a similar condition, without realizing that their illness might not be the same. It is crucial to consult a doctor who can prescribe the best treatment for your condition. Additionally, maintaining proper hygiene and strictly following the doctor's prescriptions is essential. If you do not take medications as prescribed, the microbes can become resistant to the drugs. Over time, even stronger drugs may become ineffective, making the condition harder to treat. Dr. Brian Chirombo, the World Health Organization representative to Rwanda, emphasizes the urgent need for decisive measures to combat antimicrobial resistance.
We are struggling with infectious diseases, pneumonia, TB. Yes, we've made progress, but we're struggling to get there. Malaria, we have a recent spike in the cases. We know that the studies done here in Rwanda have indicated that we're beginning to see some resistance, some levels of resistance to anti-malarials. So we're not just talking about what's happening elsewhere in other countries, but we're talking about what's beginning to affect us here in Rwanda today. So AMR threatens to undo the progress that we have made over the past 2 decades in tackling some of these diseases, where what we could do before, we can't do. And it's not just a cost in terms of lives, but the cost which DG was already highlighting some of it. It's going to be very costly to manage. We need all sectors to be working together. We need a whole of society approach where we work together to be able to achieve these global targets.
The Rwanda Biomedical Center warns that antimicrobial resistance is a serious concern, with some patients suffering from infections resistant to up to 6 types of drugs. According to the World Health Organization, antimicrobial resistance currently claims over 700,000 lives annually, and if no action is taken, this figure could exceed 20 million deaths per year by 2050. Now to education matters. University of Rwanda students have vowed to support the university and country at large in creating more Kinyarwanda data sets and support in data notation. William Evans with more.
University of Rwanda, in partnership with GIZ Rwanda, trained 32 students in natural language processing for linguistics.
We were able to train 33 students, and we hope that they were equipped with the necessary skills to annotate, to translate, so how Kinyarwanda, how we can create this data sets for Kinyarwanda to be used for translation, machine translation, as well as even using software in translations.
Linguists who have been trained in natural language processing, of course, have the opportunity to contribute to the development of specific tools or other tools that facilitate machine translation between Kinyarwanda and other languages. And to develop such tools in such technologies, you of course need different expertise. You need, of course, on the one hand, computer scientists, but you also need linguists when it comes to language who feed in their expertise, their knowledge into the development of such tools.
Some of the participants expressed their thoughts on what they learned and how they will use it moving forward.
These trainings help us by combining computer science and linguistics to create algorithms, like bringing the relationship between machine and human being, like AI. I've got a benefit because I am a linguist, so it will help me to spreading the use of AI, spreading the use of machine.
The course covered corpus linguistics, parallel corpora, and machine translations. William Evans, Mutabazi, RwandaTV News.
Thank you, Evans, for the details. Now back to health matters. The Ministry of Health reports that 90% of adolescent girls have received the HPV vaccine, a critical measure in preventing cervical cancer. The ministry aims to achieve full vaccination coverage for all eligible adolescents. girls by 2027. We have more on this. In Rwanda, cervical cancer is the second most prevalent cancer among women and girls, with an incidence rate of 28,000 cases per 100,000 women. The Rwanda Biomedical Center highlights that the country has been implementing the HPV vaccination program for cervical cancer prevention for the past 10 years. Vaccinated adolescents have reported feeling more confident and secure, knowing they are protected against this deadly disease. They vaccinated me against cervical cancer and I received it well, as I feel secure knowing that I may not contract this cancer. Being vaccinated against cervical cancer gives me the assurance that I won't get cervical cancer. The principal of the GS Ndera school emphasized that providing the cervical cancer vaccination to adolescents within the school setting is a positive initiative, as it ensures that no student is left behind, in accessing this crucial health intervention.
Personnel from the health center often visit the school and we provide them with a designated place to conduct the vaccination activities. The children are then vaccinated. This is a program that takes place every year, and we also had a similar one last year which was carried out successfully.
However, challenges remain in vaccinating adolescents attending private schools, as noted by Ndikubwimana, the head of Kigali Infant Academy in Kigali City.
We request that children aged 12 and 13 be allowed to receive their vaccinations at school. This will help avoid placing the burden on parents to take them to health centers, as vaccinating them at school is more efficient and can reach a larger number of children at once.
Hassan Sibomana, the director of vaccination programs at the Rwanda Biomedical Center, stated that discussions are ongoing with all concerned institutions to ensure that every student receives the vaccination.
Every school in the country, both private and public, should implement this program. However, challenges arise as not all schools have the same mindset. Some schools prohibit health centers from accessing their premises, or even if they do allow entry, children are not permitted to be vaccinated without parental approval. These obstacles sometimes hinder the progress of vaccination efforts. Additionally, there are instances where children receive vaccinations later than expected. We are taking this opportunity to remind all schools, both public and private, that this program is aimed at assisting children and preventing cervical cancer.
The Rwanda Biomedical Center reports that 90% of adolescent girls under the age of 15 have been successfully screened for cervical cancer, while 70% of women and girls aged between 35 to 45 have also undergone successful screening for the disease. Still speaking about cervical cancer, to reach the ambitious goal of eliminating cervical cancer by 2027, the government of Rwanda is prioritizing investments in its healthcare workforce and expanding access to prevention, diagnostics, and treatment. Among the dedicated professionals making a difference is Dr. Kenneth Ruzindana, a recent graduate in gynecologic oncology who is passionate about advancing cancer care for women in Rwanda.
My name is Kenneth Ruzindana. I am a medical doctor, an obstetrician and gynecologist by training. I have completed my fellowship in gynecologic oncology, so it's a subspecialty training dealing with treatment and management of all aspects related to reproductive health or reproductive organs, cancers, especially for women. So it involves cancers of the ovary, cervix, vulva, and abdominal lining. We also call them peritoneal cancers. And the management involves both surgical and medical. And for some cancers that are not amenable to surgical treatment, are treated with chemotherapy or radiation therapy. The management involves not only treatment, but also we are involved in the different aspects of prevention we're now very lucky that these services are available in country. This is very important because patients are able to get these services closer to their homes. They do not have to travel abroad to get these services, and basically means that they can be able to get them at a more subsidized price. These services, importantly, are also available. All our health insurances, including the community health insurance, which is the most widely used insurance system in the country. So it does mean that all patients, regardless of their socio-economic status, can be able to access these services. This is very important. It's also very satisfying at the end of the day because you're involved in the management of these very resilient patients. And it's just humbling and honor to be able to be involved in their decision making.
Now to the agriculture sector, the Rwanda Agriculture and Animal Resources Development Board has indicated that the anticipated yield for the 2025 A planting season will not be compromised despite delayed rainfall, as the government supported farmers with seeds resilient to climate change. In the 2025 A planting seasons, crops in some warmer regions should have been nearing harvest. However, the late onset of rainfall caused delays in planting, and some cultivated land was not sown with the crops initially planned. This necessitated adjustments in planning regarding what to grow, and some farmers noted that although the climate change challenges affected them, the government support ensured that all cultivated land was planted. During visits across the country to monitor the implementation of the 2025 A planting season, members of parliament found challenges related to the use of chemical fertilizers, and in some areas, fertilizers did not reach farmers. Private companies involved in supplying fertilizers to retailers and farmers emphasized efforts to increase the quantity and quality of fertilizers distributed to farmers.
So this workshop is essentially very important for the stakeholders in Rwanda because we have two main outcomes. One, we'd want to constitute a fertilizer technical working group for Rwanda. And essentially what that technical working group does going forward is that they get to validate statistics for the country, but most importantly, they get to discuss the issues. Why are farmers not accessing adequate fertilizers? Why is the pricing of fertilizers so and so? So the idea the technical working group will be is that it will be a mechanism through which all these discussions are had. The second objective for this particular workshop is that we'd want to develop a country dashboard. So a country dashboard essentially is a one-stop shop for all fertilizer information. So if you're a trader, if you're a supplier, a manufacturer, working in the government, working in the NGO world, the dashboard essentially gives you the leeway or the leverage to understand pricing, to understand inventory, etc., etc. And all this is geared towards better decisioning so that farmers are assured of fertilizer when and where they need them. So IFDC is really big on soil health and research as well. So we work with top scientists across the world, both IFDC and external scientists, to ensure that farmers get to access the right fertilizer for their soils in the form of bespoke formulations, fertilizers that are well constituted. Essentially then that translates into better productivity for nutritious foods as well as food security for the countries that we work in. Yeah, so IFDC is pretty diverse in its approach. We have various cross-cutting programs across the different countries that we work with. So in Rwanda, we've worked very extensively with the private sector in the form of the Rwanda Fertilizer Company, the Rwanda Agricultural Board, to ensure that we've done in situ trials. One, that ascertains that farmers have the access of the right fertilizers for their own productivity. We also work with farmer groups in other programs to ensure things like financial inclusion are done so that farmers are able to access fertilizers. On the policy making side, we provide the policymakers with decision support tools that then ensure that they are able to remain agile and responsive to an evolving fertilizer landscape.
RAB has acknowledged the delayed rainfall but affirmed that the government has done its utmost to assist farmers by providing seeds that can withstand climate variability, noting that efforts are underway to refine fertilizer application, tailoring it to the specific needs of each region rather than distributing it uniformly. For the 2025 season, it was planned to cultivate approximately 800,000 hectares of land, and almost all of it was cultivated. However, 5% of the land was not planted with the intended crops such as beans and maize. Instead, farmers were supported with alternative seeds resistant to climate change, which are expected to bridge the anticipated production gap. We're still watching RTV News. Now let's take a look at matters making headlines globally. The hunt for Joseph Kony has continued, with the U.S. offering a reward for his capture, citing that he's warned by the International Criminal Court for both war crimes and crimes against humanity committed in northern Uganda. VOA with the details.
Joseph Kony is the commander-in-chief of the Lord's Resistance Army, which has wreaked havoc in Central Africa for many decades now. He's wanted by the International Criminal Court for both war crimes and crimes against humanity committed in northern Uganda. We are very interested in information that might lead to his capture or transfer to the International Criminal Court in The Hague, pursuant to an arrest warrant that was issued in 2005. First, we look at the amount of risk that the tipster took. We look at the strength of the evidence and how relevant and consequential it was in terms of bringing this individual to justice. We consider what it would take to make that individual safe. If they were an insider, for example, or a member of Joseph Kony's group, they may need to relocate themselves, and so we would make sure that the reward amount was commensurate with the person's needs. It's extremely important that the individual cooperate with local law enforcement. This is not a program where we're expecting individuals to bring the fugitive to The Hague. Anyone is eligible to come forward. They can reach out to our program, they can SMS us on the number, or they can come to the local embassy and ask to speak with the security officer.
Now to Sudan, the U.S. Special Envoy to Sudan has said that he does not see enough political will from the warring parties in that country to reach a resolution to end the conflict there. According to the UN, more than 20,000 people have been killed in the war since mid-April last year.
Yet see enough political appetite from the parties to find a real resolution to this conflict, which of course at the end of the day has got to be about handing control back to the people.
That Sudan, Darfur included, is now home to the biggest humanitarian drama on our watch. Nowhere else in the world are 25 million lives at stake.
Pastef, les Patriotes, 222 675 voix, donc Pastef remporte.
Personnes sollicitant une première inscription. 943 157 requérants.
Now to Gaza, crowds of displaced people in the central city of Deir al-Balah of Gaza have been cramming at bakery, desperate to get their share of bread after many bakeries closed for 5 days because of a flour shortage and lack of aid. This and a roundup of other stories from around the world.
Ну давайте так, поверхностно, не жевать сейчас. Головой лист. Придержи голову.
We're now in the school grounds, and there are 3,700 people here, and conditions are just terrible, really.
Now to the United States. After his first nominee withdrew on Thursday, President-elect Donald Trump has announced a new choice for Attorney General Pam Bondi, a former Florida Attorney General and one of the lawyers on Trump's legal team in his first impeachment trial. That and other stories from America.
Fundamentally reject the court's decision to issue arrest warrants for senior Israel officials. We remain deeply concerned by the prosecutor's rush to seek arrest warrants and the troubling process errors that led to this decision.
That we have filed in federal court.
The story brings us to the end of tonight's bulletin, but before we leave, a reminder of our top stories. The Rwandan Parliament has started monitoring more than 100 projects tackling on socio-economic development of citizens to prevent their delay, which would hinder citizens' prioritization. On the international scene, the hunt for Joseph Kony has continued, with the US offering a reward for his capture. Thank you for tuning in to today's broadcast. On behalf of the technical and news production team, we wish you a productive and restful weekend. Until next time, goodbye.